Just like humans with asthma, asthmatic cats need effective treatments to help manage their symptoms and provide relief in the event of an asthma attack. These treatments involve medication, management strategies, and other home remedies, but medication should always be the first line of treatment for managing feline asthma. Stress management. Stress is a well-recognized asthma trigger for individuals suffering from the condition. If you have an asthmatic cat, avoiding stressful situations, such as other pets, kids, and loud noises will go a long way in preventing an asthmatic attack. Remember that cats are creatures of habit, and small changes cause them stress. So, if you need to change their diet, routine, or even rearrange the home furniture, it is safer to do it gradually. Avoid dusty and strongly scented litter. If your furry friend has been diagnosed with asthma, you need to choose the right kind of litter. Avoid any dusty litter or litter with strong artificial smells. This can irritate the respiratory tissues and trigger an asthmatic attack. Keeping the litter box clean is also a must for any cat, especially cats with any respiratory conditions. Avoid covered litter boxes and choose an area with good air circulation to place your kitty's litter box. Avoid air pollutants. Avoid cigarette smoke and chimneys around your cat. Anything that can irritate the respiratory tissue could potentially trigger an asthmatic attack. Living in cities with highly polluted environments and poor air quality is not a good option for cats suffering from asthma. Keep the kitty away from the kitchen if you cook spicy food. Avoid perfumes and fragrances. Maybe your favorite perfume, the amazing vanilla-scented candles, bathroom aerosol fragrances, or the strongly scented floor cleaners could be the factors causing irritation of your cat's airways and triggering the asthma attack. Avoid any strongly scented substances around your asthmatic feline. Recognize and avoid allergens. Mold, mildew, pollens, other animals' dandler or feathers, dust mites, and certain food are all factors that your cat could be allergic to and that are triggering the inflammatory reactions and symptoms of asthma. Recognizing the specifics is the first step towards the management of the condition. Several asthmatic cat owners report their cats to stop suffering recurrent episodes after moving to a new apartment and later attributing it to mold presence in the old place. Cut the carbs. Carbohydrates are not a natural diet for carnivore species. A cat's diet should be based on animal-sourced proteins and fats with minimal carbohydrates. Carefully read the labels of your cat's food and avoid any grains, such as wheat, corn, rice, oats, or barley. Avoid potatoes as well. As a general rule, wet cat food has lower amounts of carbohydrates than dry cat food, but if your cat cannot live without its kibble, search for the lower carb options in the market. Change the protein source. Many cats suffering from asthma benefit from a change of protein source. If your cat has been consistently on a chicken or fish diet, try changing the diet to a new protein. Gradually introduce a rabbit or duck diet. Give it a couple of months on a diet exclusively of this new protein to see if the sensitivity to the previous protein might have been behind your cat's asthma. Honey. Raw, unpasteurized organic-grade honey is very beneficial. Its anti-inflammatory, antioxidant, and antibacterial properties can help reduce swelling and soothe your kitty's respiratory symptoms. 1/4 to half a teaspoon twice a day can benefit an asthmatic kitty. Omega fatty acids. Regular supplementation with omega fatty acids will benefit your asthmatic cat. It is essential to give these fatty acids in fish oil instead of flaxseed, as cats can metabolize them easier. 500 milligrams per every 10 pounds of body weight is a standard daily supplemental dose for a cat.